We'll call the Montgomery County April 24, 2018 meeting order. Madam Clerk, roll call.
Chairman Headwell.
Present.
Legislator Wilson.
Present.
Legislator Duchessis.
Present.
Legislator Peck.
Present.
Legislator Isabel.
Present.
Legislator Patel.
Here.
Legislator Kelly.
Present.
Legislator Sweet.
Present.
Legislator Diamond.
Present.
Stand for the pledge of the flag. Mr. Wilson, will you lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Stand for a moment of silence. Thank you. The next part of the meeting is the public comment section. If there's anyone from the public that would like to speak, please come to the rail, state your name for record, and we may have the floor. Seeing none, we will go to the next part of the agenda, and we have some proclamations tonight. And the first one we're going to have is we're going to be recognizing Dr. Rao.
I feel very privileged this evening to be able to recognize you for being such a humanitarian and friend to the greater community. Thank you. Whereas Dr. Govind Rao has committed to serving as Montgomery County Public Health Department Medical Director since 2007, and whereas in his role, Dr. Rao is known for his knowledge and professionalism while overseeing standing orders and public health protocol for the county, and whereas Dr. Rao also leads the largest pediatric practice in Montgomery County and goes above and beyond to treat patients and help families in our community, and whereas he helps soldiers, displaced hurricane victims, and students, and whereas, although Dr. Rao cares deeply for all residents, he has a passion for assisting the Amish community and has aided in the vaccination of over 100 individuals, made home visits, and bonded with the students in the Amish schools. And whereas another one of his passions is enacting a bill that he introduced to the Senate in 2014 that will screen all teens in the states ages from 12 to 18 for illegal drug use during annual physicals. And whereas colleagues describe Dr. Rao as a true friend who is humble and kind, whereas he truly does whatever it takes to assist building a healthy community. Now, therefore, be it resolved, County Executive Matthew L. Ossenfort, Legislative Chairman Robert Headwell Jr., and Legislator John M. Duchessis, on behalf of the Montgomery County Legislature, hereby proclaim Tuesday, April 24th, 2018, as an official day in Montgomery County to honor, recognize, and thank Dr. Rao. Thank you.
Thank you.
Thank you so much.
Yeah.
Dr. Rao would like to speak a little bit first.
Yeah. What are you?
One is going to talk also. Yes.
Later. Okay. Yeah. Maybe I'll say that. I just want to let you know that the children are very precious, and we have to make sure, as a public health point of view, we have to make sure they get good health and education, and try to make them as productive as possible so they can take care of themselves and help others too. Now, since I just want to mention about my children too, my eldest daughter, Usha Reddy, Dr. Usha Reddy, she's a pediatrician also, and she helped me to set up the practice in the beginning, and she was very humanitarian, and I think I learned from her a lot, how to treat the children like that, and I give the credit to her for being myself and my wife, busy with the other activities. My eldest son also, he was in the Union College. He got seat in medicine, then he decided to go to Navy. Then he retired after 3 years as a lieutenant. And then he went to medical school. And right now he is one of the top doctors in Virginia, Richmond, Virginia, as a pediatric neurologist. He's practicing there, and I'm very happy to hear that. And my second son is a sports medicine fellow, Dr. Naresh Rao. He has a busy practice in Manhattan as a sports medicine doctor. Not only that, he is the medical director for the New York Athletic Club, and also is a medical director for the Olympic water polo team. And he goes all over the world with the water polo team. And he wrote a book also recently for the athletes. It's a Step Up Your Game. And it was in Barnes & Noble's bestseller. I am really proud of them. Thank you very much. Having said that, in my practice, I came to this place in 1972, and in the beginning, we used to see children with a lot of illnesses like croup, pneumonias, meningitis, etc., etc. At the time, before a child goes to kindergarten, we used to give only 5 or 7 shots. Now, we give almost 20 shots before the children go to kindergarten. Believe me, at that time, we had 2 hospitals, and both the hospitals had 10 beds each, and both the hospitals were filled with the sick children. Like you probably noticed that in the past, we used to have a child in the winter time with the croup. They cannot breathe. They used to come to the ER. We had to cut the throat. This was one particular bacteria they call invasive Haemophilus influenza. In 1974, they made a vaccine. Now we don't see that illness at all. And hardly nowadays, I admit only 6 or 7 patients in a year because of the vaccinations. In my practice now, besides the illnesses, the most important that I see now are the behavior problems, mental health issues, and drug addiction problems. And unfortunately, the psychiatric, place we don't have enough mental health facilities to take care of these children. I got more involved with the drug addiction problem because I have seen in my practice, drug addiction has no predilection for race, color, or economic status, or education status, because they're so addictive. And our children between 12 and 18 years of age are so vulnerable, and drugs are plentifully available. And even the painkillers too. There was a report like 1/3 children who are on painkillers are likely to develop addiction, and whereas adults is 1 in 8 develop addiction. And so what I did was that I thought nobody denies that drug addiction is a disease. Now there are health laws to detect very, very rare diseases. Starting from newborns, we do the PKU testing for the heel stick test for 39 or 40 diseases, which we haven't seen at all. In my practice of 47 years, I saw only 2 children with those diseases. But every newborn has to have the heel stick for the disease detect, which is a good thing. Same with the lead level too. Maybe in my practice, I had 10 children who had a lead toxicity where we had to treat them. Otherwise, we just monitor them. But every lead, I think in 1975 onwards, there's no lead in the paint at all. Right. So in other words, houses built after 75, if a child are living there, there's no point in doing the lead test. But every child has to have a lead testing done at between 1 and 2 years of age, because there's a health law. At the same time, drug addiction is a disease, is in epidemic proportions, and people are dying like anything. And there's no health law to detect this disease in early stages, so we can take care of the illness in early stages. A stitch in time, saves 9. So Senator Tachik wrote a bill for me, this S7934. It was read twice in the Senate, and after that she lost elections. I'm trying to pursue Senator. I need your support too. There's no harm in doing it as a part of the physical, because it's a disease. Just have a routine drug testing done, detect in early stages, and take care of the problem rather than wait and then spend time on rehab or education and law enforcement officers. I think that's a waste of money. And this way we can save a lot of money too. The economic loss due to drug addiction is almost $170 billion every year, whereas for diabetes only $130 billion and cancer is $150 billion. So this is a very expensive thing. We can save a lot of money. I need your support and help. Okay, thank you very much.
Lucky to have you.
In 1964, Dr. Rao came to the United States of America with $4 in his pocket, 2 suitcases, and most importantly, his education. Dr. Rao graduated from Gandhi Medical College in India. In 1972, Dr. Rao and Mrs. Rao moved to Amsterdam. Dr. Rao and his wife have 4 children, 3 who went on to become doctors, and the youngest who tragically died in an accident in New York City. Dr. Rao and his wife did not allow the death of their daughter to hinder their lives. They used the tragic event in their lives to enhance the lives of many in the community. The couple used the money that they had saved for her college fund and turned it into a non-profit organization named the Nina Rao Charitable Corporation. The goal of the corporation is to improve health care and education in children and women in the USA and India. Through the corporation, Dr. Rao and his family have donated millions to local hospitals, organizations, and individuals, as well as helped thousands of homeless in India. Dr. Rao has had many achievements, some being the Public Health Medical Director, establishing a voluntary drug program for Amsterdam High School and middle school students in the past 10 years, sponsored YMCA summer camp, Nina play area at St. Mary's School, contributes to the OFA to provide meals for the Meals on Wheels program, supports local pantries. Amsterdam Free Library developed Nina Rao collection of books. Rao Outpatient Pavilion, St. Mary's Hospital, where he donated $1 million to aid in the opening. The list could go on for all that has been done by Dr. Rao for the community. One of Dr. Rao's passions is enacting a bill that will screen all teens in New York State ages 12 to 18 for illegal drug use during annual physicals and will require insurance companies to cover the drug testing. The bill is still waiting to be passed as it was first introduced to the Senate in 2014. Dr. Rao is an essential member of our community as well as the Amish community. Dr. Rao has an open-door policy at his office where he serves many Amish families. Dr. Rao has not only vaccinated over 100 members of the Amish community with public health, he does not charge and has been known to stop by the local Amish schools with pizza and ice cream. One phrase that is said by many, "I don't know what we would do without Dr. Rao." That statement holds true for all in our community, and especially for us at Public Health. Thank you, Dr. Rao, for all that you do, not only for us at Public Health, but for everyone in Montgomery County. Congratulations. Sarah Baranko, our director, has something to present also. This is for us from us at Public Health.
Very nice, thank you very much.
This is actually for Mrs. Rao because
Yes,
we do a lot for Dr. Rao. We do.
No.
But we know behind every good man is a good woman, and she does a lot for us and letting us steal her husband from her to go to meetings and provide a lot of community resources. So we just wanted to present you with a very small gift. So thank you.
At the same time, I just want to mention one thing, okay? The health department has been wonderful here. Sarah, Laurel, and everybody, Wanda, and they came to my offices to help me how to run the practice and everything like that. So I really thank you very much for helping me to carry out the practice over here. Thanks a lot. Thanks to everybody.
Thank you for the
In the series of recognizing different departments, tonight we are going to be recognizing our public health department. I kind of was it's like a family affair to, a little bit for me, because I know one person in the department real well, but I'm kind of shocked on what they actually do. And I think some other people would be the same way, that early intervention, car seat distribution, immunizations, rabies clinics, I mean, there's education. There's just so much that this department does, and I don't think that a lot of people know what actually goes on, and I'm hoping that, again, when they look at the public, the release, they'll see some of the things that happens within the county. So on that, the public health department want to come forward.
You can have yours.
That's it.
I'll be over here with this, okay? Thank you all for being here, Dr.
Yes, you are, Dr. Rao. You should probably come up here. we couldn't have a health department without you.
Thank you.
The legislature does appreciate this opportunity to recognize all of you and say thank you in advance for your service. Whereas the County of Montgomery is pleased to recognize employees who take pride in their career and who are committed to giving back to the people they represent. And whereas the employees within the county's public health department serve approximately 49,000 residents and actively seek ways to broaden their reach through a variety of programs, clinics, and other services such as early intervention, immunizations, car seat distribution, rabies education, and whereas this department serves as an advocate for the community's health, and employees are dedicated to ensuring the public and fellow county employees are informed on numerous topics that may affect their physical or mental well-being. And whereas public health employees strive to promote active lifestyles in Montgomery County, are ambitious and dedicated to the betterment of their community. Now therefore be it resolved, County Executive Matthew L. Ossenfort, Legislative Chairman Robert Hedwell Jr., and Legislator John M. Duchessis, on behalf of the Montgomery County Legislature, hereby proclaim Tuesday, April 24th, 2018, as an official date in Montgomery County to most gratefully recognize, sincerely appreciate, and wholeheartedly thank the Public Health Department staff for their hard work and commitment. Thank you.
I'll say something else. She wants us to scoot.
Oh, we're squishing together?
Yeah, squish together. Apparently we need a wide angle light. I know, I said. Thank you.
Thank you. So just quickly, I just want to say that I couldn't run our department without the work of these ladies and what they do every day, as well as the assistance of some of our other departments. And I'm very blessed that I have not only the support of the women that stand up here with me, but the legislators as well as the county exec and our community. And I think the biggest group of people that deserve our thanks is our families. Most of us are on call 24 hours a day, and sometimes that interferes with family birthday parties, finding a babysitter, various things that we put on hold because of our job duties. And without the love and support of them, we wouldn't be able to do this. So thank you to all of you and to our families.
Thank you.
Thank you.
Thank you.
Madam Clerk, do you have any correspondence?
Just a reminder that Law Day is May 1st at noon. If you haven't decided if you want to go, so let me know. And following on Monday, May 7th, is Full Knot Community Action Dinner at the Holiday Inn.
going to need to have a motion to approve the minutes from the Economic Development Committee meeting on April 17th, the Health and Human Service Committee meeting on April 17th, Public Safety Committee meeting on April 17th, Physical Service Committee meeting on the 17th, Personnel Committee meeting on April 17th, and the Budget and Finance Committee meeting on April 17th. Motion by Legislator Pep, second by Legislator Isabel. Any discussion? All in favor?
Aye.
Opposed? Abstained?
Pass.
Okay. The acceptance of budgetary transfers. I have a motion for the aggregate budget transfer for April 2018 and the budget transfers from March 22nd, 2018 to April 19th, 2018. A motion? Motion by Legislator Wilson. Legislator, second by Legislator Kelly. Any discussion? All in favor?
Aye.
Opposed? Abstained?
Pass.
Acceptance of the procurement record. Got a motion? Legislator Pep, second. Legislator Kelly. Any discussion? All in favor?
Aye.
Opposed? Abstained?
Pass.
All business? Hearing none, we have new business. Resolution number 83, resolution ratifying a memorandum of agreement between the County of Montgomery and Montgomery County Deputy Sheriff Police Association Incorporated, the Deputy Sheriffs, and authorization of the county executive to sign a contract for a period of 1/1/2013 through 12/31/2017. Sponsors were Diamond and Sweet. Discussion? The only discussion I just want to bring up is that in the last year, I've had a lot of problems using fund balance. And I think that in a case where we have contracts that have not been renewed or that that we should be putting money away for a rainy day fund so that when we get to the point of signing a contract, we have the money there to do that and that we're not taking from the fund balance. Any other discussion? All in favor?
Aye.
Opposed? Abstained?
Pass.
Resolution number 84, resolution amending the 2018 operating budget, Deputy Sheriff salaries. Sponsors were Sweet and Pep. Discussion? All in favor?
Aye.
Opposed? Abstained?
Pass.
Resolution number 85, resolution amending the 2018 operating budget, Montgomery County Bus Transportation System. Sponsors were Pep and Wilson. Discussion? All in favor?
Aye.
Opposed? Abstained?
Pass.
Resolution number 86, a resolution adopting introductory local law C, a local law establishing the county planning board in Montgomery County and rescinding a local law 1 of 2014. Sponsors were Wilson and Diamond. Discussion.
Sure. There was some question about the resolution, and just to clarify it, prior to this local law, rescinding the local law, the alternate members were only available to be part of the quorum if the regular members weren't available. What this resolution does, not only allows them to create a quorum if need be, it gives them voting privileges. So before they didn't have voting privileges. So that's the crux of this law.
Was there?
So I understand the direction, so it's not just to fill the quorum, it's to add additional voting.
If there's, if one of the 9 members are absent, then they would have voting privileges.
So it doesn't add 10 or 11
No.
votes.
No, never more than 9.
Any other discussion? All in favor?
Aye.
Opposed? Abstained? Resolution number 87, a resolution establishing the position of Director of Patient Services, eliminating one community health nurse position and reallocating the grade of the remaining community health nurse. Sponsors were Pep and Chester. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 88, resolution establishing a public health program coordinator trainee position. Sponsors were Isabel and Wilson. Discussion. All in favor? Aye. Opposed? Abstained.
Pass.
Resolution number 89, resolution amending the 2018 operating budget, accepting safe harbor funds. Sponsors were Diamond and Sweet. Discussion? All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 90, resolution authorizing the county executive to enter into an intermunicipality agreement for the provision of youth service programs. Sponsors were Pep and Wilson. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution 91, resolution amending the 2018 operating budget, federal Burn JAG grant. Sponsors were Pep and Wilson. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 92, a resolution authorizing the abandonment of a section of unused county road, Bullshit Road, Town of Florida. Sponsors were Diamond and Sweet. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution 93, resolution rescinding resolution 63 of 2018, awarding material bids and authorizing the county executive to enter into contracts. Sponsors were Sweet and Pep. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution 94, resolution authorizing the county executive to enter an agreement, grass and brush control on county roads for 2018-2019. Sponsors are Sweet and Diamond. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution 95, resolution authorizing the county executive to award air valve replacement project control and appropriate fund balance to cover the cost of the entire project. Sponsors were Diamond and Sweet. Discussion? All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 96, resolution amending the 2018 operating budget. Sponsors were Diamond and Pep. Discussion. We need to amend Resolution 96. And under the financial impact, we need to remove the clause that says, which includes retroactive to January 1st, 2018 of the 264918. I'll make that motion.
I'll second it, Mr. Chair.
Second. Now discussion on the amendment. Yes.
So what's happening with the 2649, is that you can clip somewhere else?
Right now, it's going to stay in that 10,638, and if it's not all if that all that's not used, then it will just be used somewhere else.
It can't be retroactive. That's what I understand.
Right?
And we'll be going forward.
So on the amendment, all in favor?
Aye.
Opposed? Abstained. Okay. Now, on the resolution as amended, all in favor?
Aye.
No,
Discussion.
discussion.
Chair, I'd like to pull my sponsorship. I don't see a new non-bargaining agreement here. As I mentioned at the committee meeting, as a long-time labor person, I don't like piecemeal contracts. So I'd like to for my sponsorship.
Would someone, would someone like to
I'll pick that up, Mr. Chairman.
pick that up? Okay. Any other discussion on this? All in favor? Opposed?
Aye.
Oh, hold on. We do, roll call.
We have two, we have, Legislator Patel and Legislator Diamond. Okay, let's do a roll call then. Sorry, Cheryl.
Legislator Duchessis.
Aye.
Legislator Pat.
Aye.
Legislator Isbell.
No.
Legislator Patel.
No.
Legislator Kelly. Legislator Sweet.
Aye.
Legislator Diamond.
No.
Chairman Hadwell.
Aye.
Legislator Wilson.
Aye.
Yes.
Resolution number 97, resolution establishing automotive mechanic helper position. Sponsors were Patel and Diamond. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 98, resolution authorizing county treasurer to distribute the mortgage tax money. Sponsors were Sweet and Isabel. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 99, resolution designating an additive or depository for county funds in the name of the county treasurer during 2018 and fixing the maximum amount which may be kept on deposit therein at any one time. Sponsors were Diamond and Sweet. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Resolution number 100, resolution approving abstracts of audit claims. Sponsors were Diamond and Wilson. Discussion. All in favor?
Aye.
Opposed? Abstained.
Pass.
Anything other under new business? Legislator Patel.
And somebody brings up the data on whether others know about contracts. Try to get.
Where we are right now is that Matt and I believe Eric have been getting stuff together from other counties to see how other counties are doing, how they do the same thing, looking at, do they just, some counties pay for the materials, some do it like we're doing it, so they're just trying to get as much information of how else is being done, and then we're going to be sitting down, or Matt's going to be sitting down with, and trying to come up with a long-term plan for that.
I think it's important that we do finally get some closure on this and have a long-term plan.
One of the questions that has come up, and I had was, most of the contracts come out of the executive's office. How is this? Why did this one contract kind of fall in our laps? Why isn't it really being negotiated with the? And maybe you've been here 4 years. Maybe you can answer that question of how did this one fall in our laps and all the other ones?
I can't explain why it did. All I can say is in my district, the town of Amsterdam, that's one of the highest costs. There's just so many inequities between the towns in the amount of mileage that they have, the amount of snow that they receive, whether they're up higher in elevation or lower down in the valley. The quality that are expected, like Miami Avenue, used to be, a lot. So I just hope that in the future, when we do negotiate this, that maybe it's time that we negotiate separately between each town and express or define what our quality that we're expecting from that.
I think that's one of the things that was discussed. We were at the last meeting. That was one of the things that was discussed back at that time, because Miami Ave being 4 lanes wide versus others being 2 lanes wide, and some counties or some towns use a lot more salt than others, some materials and stuff. So I think a lot of those things were discussed, and we see that. But it's, as you know, it's a very complicated thing to figure out and come up with something that's fair to everyone. And and the bottom line is, we're trying to keep the costs down on our side. So it's as well.
Something that had come up in our committee last week, county attorney, I believe was there on Tuesday last week.
Yes.
The question was brought up about the Verizon contract with the jail. Where does that stand? Where does that stand?
I haven't heard anything further on that at this point.
What was the last negotiation with the guy? I heard you were still in negotiation with him.
The last thing I heard is like the ball was in their court and no one's moving it forward.
So basically, it's dead.
As far as I'm aware.
Anything else?
I'd like to get back to that discussion regarding the roads. Spent a little time with this, as the chairman had. I don't think we can ever make an adjustment that's going to make sense. I think that the whole system really has to be revisited. And there was a road study done in the past. There are some recommendations there, but certain roads that are really short distances, and there are a lot of roads included that don't make any sense. And certainly the maintenance per mile is different in different towns. So those towns that have roads that are subject to high winds and whatever the circumstances that create the differences. So, and in addition to that, it's hard as a legislator to start to set some terms for the contract, and really that's not our purview. The contract negotiation would be something that the executive office does. What we can do, though, I think, is to take a look at the entire system. And I would really like to go back and visit that. Maybe at one of our workshops we can discuss, at least as a starting point, we can take a look at the road study that was done and see where that leads. But I don't think we're ever going to be able to adjust it in a way that makes sense. This is something that I've been interested in for 20 years.
I think it's time, and the question is who should be negotiating it, or for what reason. I think it's time that, none of us like to spend money, but it has to, we can't continue to just say we'll tack on $50 this year per mile. Because it may work out for some, but not for others. I think that it's time that we put some money in the budget next year for an engineering study that collects data locally, that now we can look at that, or an executive can look at that and say, look, this is what makes sense. Because we're all just guessing what we think makes sense. And, I have conversations every week with the superintendent of highways for the town of Amsterdam. And this is all we talk about. And he has a ton of data. He probably has the best data that's available. And it's very frustrating to say, I don't know what to do. And so I would hope that we can at least make this a priority to figure something out that doesn't just rely on, well, let's add $50 more this year.
I absolutely would support that initiative. And I've seen the data that you're talking about. Because the further compounding issue, of course, is that people who direct those services for the towns are elected officials. So there are many layers there. And I think that as I mentioned, I definitely would support that initiative.
I think one of the frustrating things is we have expectations, but no delineation of what our expectations are as far as the roads go. This road gets salted, this road gets sanded, we want it down to pavement, we want it plowed 4 times. I really just said
The basic definition of a contract, really, what you're paying and what you're going to get. Yeah.
Anything else? Motion to adjourn. Second. Legislator Pep. All in favor? Adjourn.